Overall, interior and exterior, there's over 8,000 signs in total.
Yeah, it's a staggering number.
There's a lot of strategic thought and effort that gets put into a full building sign plan for a building that is 475,000 square feet. We know exactly where each sign is going and what the content is, and like you're building out the sign program for all of the floors where everything lives.
A sign program has to be cohesive. Everything should relate visually. The iconography, type, style, font height, color, the mode of wayfinding should all have a rhythm to it.
To be successful.
Yeah, definitely. Every commercial building, there are ADA guidelines that have to be adhered to, with everything from the sheen of the material, to the letter height, to the spacing between each letter.
And then the architecture of that building is based on these chamfered architectural features that you had to pick up and identify and base your sign design around that.
It was fun to leverage that architectural detail in a fun, bold, easy to read, colorful way that helps people identify what floor they're on. So there's a neat detail to include in part of the design of those big floor number indicators. I remember working on the big UW Health logo letters, and that was on a curved limestone wall, and the amount of precise coordination that needed to happen in order just to attach the sign, to bring electricity to it. Each one of those panels were custom machined, these crazy limestone panels, and they were all attached via a grid system. You can't just go up and start screwing letters to a wall system like that. We had to go out ahead of time and pre-locate where all the electrical feeds were going to be. We had to go up there with a pattern in a very precise location. You got a wire going through the wall here, here, and here, working with the electricians and the wall system company. The project managers, the site superintendents for each one of these trades that had to be involved in making sure.
The structural engineers, the electricians, like all those people had to come to the table prior to that process even starting.
Yep.
In the actual built environment was a lot.
The other thing is, in the parking ramp, that's all pre-stressed concrete beams with steel cables. Those are engineered beams, and you have to be very careful about how deep your penetrations are into material like that, so you're not affecting the structural integrity or running into big, giant steel cables when you're trying to drill.
They have to locate those
Yep.
steel pieces to make sure, it's
Yep. They had to literally
intense.
had to scan a wall and tell us where there were steel structural cables embedded in the concrete, so that when we were doing our attachments, we didn't run into those. And I often joke that people think these signs are sitting on a shelf and we're just waiting for a phone call. These things are built, a majority of them, raw materials. They start as a flat sheet or a raw extruded aluminum tube, and they have to get fabricated by our craftspeople out in our shop.
So when it comes to how we're building certain signs out in the shop, really channel letter set signs, monument signs, or directional signs, we always start with the CNC process. Once we get our drawings through pre-pro, they set up all of the drawings and basically our blueprints of what we're using to build off of. So once the router parts get going, then it's into fabrication. So it's all of the building, cutting the tubing material, welding everything together. One of our things, especially for UW Health, is to make sure that they're serviceable signs. So a lot of these have screw mounted faces, which makes it really nice for the field team to get out there and make it easy to do any kind of service work. Once it gets through the fabrication portion, then it goes into finishing and then paint. So when it comes to assembly, once all the wiring gets in and all the lights get in and everything's done there, make sure everything's waterproofed, make sure everything is sealed up and good to go. And then the grand finale, we shut all the lights off and everybody gathers around and we flip the sign on and check for any imperfections there. But 9 times out of 10, it looks spot on. So
Each patient is there for different reasons, and they are really preoccupied with what's going on in their lives. So over signage can complicate that journey. And we uphold that clear communication is key, not over communication. We have a lot of different standards we got to abide by. We have ADA standards, we have facility standards. So our goal is to uphold our standards to the best of our ability and to look out for the patient's journey.